Health and the Department of Trauma and Burn, I want to thank you for joining us today as we have a discussion on burn safety. Summertime is a fun time for all of us. We love hanging out with our family and our friends. And many things that are associated with summertime fun includes bonfires, barbecues, and even fireworks. Now, while they're fun, they do pose some dangerous risk. So today we are going to discuss some of those risks, some ways you can prevent those risks, and what to do if you are injured and you receive some sort of burn. I am joined today by some of Cook County Health's fantastic burn and trauma team to discuss summer safety. Let me introduce myself first. I am Mercedes Young, the trauma and burn analyst here at Cook County Trauma, and we have others with us. As a reminder, before we start, there is a live chat feature. So if you have any questions or you need additional information, you can put your comments in that chat and they will be addressed here. I like to start off by having everyone introduce themselves and tell everyone watching a little bit about you and what you do here. We're going to start off with Dr. Polikides.
Hi, good afternoon, everybody. I'm Dr. Stathi Polakidis. I'm the Director of Burn Services here at Cook County Health and have been in this role now for the last 18 years. I'm blessed to be able to take care of our patient population for the pure fact that I have an opportunity to really impact good on the community here as a whole. I've trained and lived in Chicagoland for pretty much my entire life, and obviously, I'm very interested in giving back to the community, and this is just one of those ways where we can give back to the community and support everyone's health and well-being during the holiday season.
Thank you so much, Dr. Polikides. Next, we're going to go to Catherine.
Hi, good morning. My name is Catherine Simonek. I'm the manager of the burn unit. I've been with Cook County now for about 6 months, but previously I've been ER nurse for approximately 15 years, so I am used to seeing some burns when they first walk through the door. I'm super excited to be here today and to help answer any questions about burn and just help prevent maybe some burns from this summer and the 4th of July weekend.
Thank you so much, Catherine. We're going to roll right into Andy.
Hi, my name is Andy Wheeler. I am a licensed clinical social worker, and my role here is the manager of our trauma recovery, intervention, and prevention team. What that means is myself and the folks on my team provide mental health care and psychological and emotional support to our patients and families that come through the trauma and the burn unit. I've been here at Cook County Health for almost 12 years, and in that time have met with many, many, many patients and families to cope with some of the non-medical consequences of surviving and going through having a burn or a traumatic injury. There can be lots of common mental health aspects of dealing with your wounds and memories of what happened to you and things like that. So thank you for having me.
All right. Well, thank you. We know who everyone is. We know who everyone is. So we're going to jump right into the questions. My first question is going to be for you, Dr. Polikides. Can you tell us what are some of the most common sources for burns during the summer?
Absolutely. First and foremost, as the summer starts to kick off, a lot of people want to kind of clean up their yards. And as they're cleaning up their yards, whether there's leaves or trash or what have you, a lot of times it almost lends itself that they want to burn those different substances, and they use some type of an accelerant to burn, the leaves or the trash. When that happens, unfortunately, the accelerant, whether it be gas or diesel or some of the other different fuels from propane, etc., kind of yield themselves to actually become unpredictable in nature. And whether you get some of that actually on your clothing and it catches you on fire as you're igniting the stuff you're trying to burn, or what have you, a lot of patients come in with burns early in the summer from that perspective. Second place we see a lot of burns is people first lighting their grills for the first time as the summer kind of kicks off. The grill's been stagnant for a while, and again, whether it's a propane or you're actually going to just good old-fashioned charcoal, they want to kind of get it ignited, and they put a lot of accelerant on that as well, and that can ignite. And again, it's so unpredictable in terms of how the fire can go, whether there's wind changes, etc., and that can cause significant burns as well. And as we fall into the holiday season with the 4th of July, We then get into the firework burns, and everybody thinks they have control of the fireworks, but the problem becomes adding alcohol and drugs into setting off fireworks then poses an extreme threat because you really don't have the appropriate senses to be able to manage these very dangerous implements with safety. Even something as simple as a sparkler can burn as hot as 1800 degrees and can cause significant burn from that. And so what we really want to do is have everybody enjoy the summer, be home with their loved ones. We're here to be able to take care of you if, God forbid, you do sustain an injury, but we really want everybody at home. We really don't want to be operating on big burns and things and having people in the course of the summer in the hospital setting. We'd rather them be at home with. But again, we're here and we're available to actually be able to help everyone for that matter, regardless of how big or small their burns are. Safety and a better. And that's really kind of the big three as I like to look at them as we look at burns through the course of the summer.
I think you touched on kind of my next question, but because maybe it was just a surprise to me. When you said sparklers, I think a lot of times people underestimate the impact that they have and they allow small children to use them. And that can be very, very dangerous. So, are there any burns that may surprise our listeners that you've seen?
Everybody thinks you catch fire when you actually use fireworks. It's really more kind of exploding and you don't actually catch fire, but you lose, limbs, digits, fingers, etc. And so we really want to avoid that. They're so dangerous, even though they look harmless. Even something as simple as a Roman candle, again, gets, no respect in terms of the magnitude of danger and damage it can cause. It can catch somebody on fire, catch their clothing on fire, and cause them to sustain significant burns. You look at the community, the fire department here in Chicago has done many different events where they show how a sparkler or an actual Roman candle can catch the clothing on fire of a child, and they can burn within seconds to the point where they're burned completely 100% of their body. As you mentioned, the sparklers, again, they look totally harmless. You light them, you get a little bit of fun and excitement from the kids. You want to put them in the kids' hands. They actually can rain down some of the sparkle onto the child's hands, and then they drop it into their shoes, drop it onto their clothing. They can sustain very significant burns. And again, thinking that those are harmless, again, poses great risk to the little ones that are holding them because they're, again, not facile with holding those different kinds of very dangerous processes.
Okay, thank you. Very interesting. Now, some burns can obviously be treated at home, of course, the minor ones, right? But what should someone do if they receive or sustain a burn at home? What should they do first? Can you give us kind of the steps?
Sure. Everybody wants to go to cold water because they think cold water is going to soothe and cool the burn. And that's actually a good thought because we want to minimize the pain of minor. Probably a better option is actually lukewarm water. What it does is allows for the skin to still continue to get blood flow and allow for healing to occur. What cold does to the burn is it vasoconstricts or it closes down the little blood vessels and it prevents the burn from healing like it normally should. And so you might take a little bit of a first or second degree burn and you could make it a very deeper, second degree or third degree burn. And so that's the first thing you could do to kind of cool the burn. Obviously, when somebody gets burned, the first thing we want them to do is either stop, drop, and roll or get away with whatever's burning them. Then the next step would be a lukewarm, shower to wash whatever's on them. Once that's the case, I would still recommend that they come to a local emergency room or to our hospital here, where we can provide them care 24 hours a day, 7 days a week. Our emergency room is very facile at managing the burns and very facile at getting people through the system very quickly to make sure that they get care immediately. And that's down in our trauma bay here, Stroger Hospital. We're here for clinics 5 days a week, and we're here available 24 hours a day for care for burns.
Wow, Dr. Polikides, that was very interesting information that you shared because to the layperson, we think if you burn yourself, I want to cool it off instantly, immediately. So apply something cold to it. And to know that you should actually do the opposite, apply maybe lukewarm water. So thank you so much for sharing that. Moving on into kind of some common mistakes and, those old wives' tales, right? On what you can apply to a burn at home to fix it, those home remedies. Can you tell us what are some mistakes and what are the dangers to applying those type of treatments to your burn?
Absolutely. So there's many different cultural and, as you said, old wives' tales as to how to manage the burn. it's something simple and it's something simple, good old triple antibiotic or bacitracin that you could buy over the counter at a Walgreens or an Osco or even a Target Walmart are very simple and easy fixes. We like to put some type of non-adherent over the burn to minimize the pain and minimize the adherence of the gauzes over top of those wounds. Realistically, though, what happens is a lot of families from a cultural perspective will put toothpaste, mayonnaise, mustard,
Butter.
butter, and there's a whole bunch of different home remedies. Not that I'm saying any of these are absolutely wrong, but what happens is sometimes they stick to the wounds and can cause more pain and more difficulty and cleaning them up when they do come to the hospital. And so from that perspective, we kind of want, the families out in the community to understand we will 100% accept their treatment remedies, but if they can minimize what they do, it'll minimize the pain when they do come into the hospital in terms of how much we have to clean off and cause pain to their loved ones. We really want to minimize that.
Definitely understood. Catherine, I just want to go to you. Did you have anything that you wanted to add to this?
Yeah, no, we've definitely seen people come in with some weird things put on their burns, and like Dr. Polakidis said, just keep it nice and clean with the warm water and bring it in, and we'll be happy to take a look at it and put the appropriate cream on there. I will say this too, though, when you're at home, if you're taking Tylenol and Motrin and you see that pain is still really bad, that's also another indication of coming to the emergency room. If you have any burns with blisters, don't try to pop them and come in and just get a second opinion.
Okay.
That's probably it.
Yeah. And then, Andy, I'm going to go back to you for a moment. I know we were discussing the fireworks and the effects of how sometimes small children are injured or adults are injured. Can you tell kind of some of your experience from the social work perspective of how to handle that mentally at home when you kind of that initial shock of my loved one, my family member, my friend has been burned?
Yeah, sure. So I think it's important to recognize that anything that could be even perceived as life-threatening, even if it might not seem that way to you as an adult, if you think a child is perceiving that thing as life-threatening, that could be traumatic for that child. And so things like fireworks or what might seem like a not large burn to an adult, if that child perceived that as life-threatening, that can be traumatic for the child. And things that are important for parents and loved ones and adults to pay attention to is in the days and weeks after that incident, if your child is showing signs of what, I don't really like this term so much, but kind of regression in a way. So if you have a 10-year-old that's almost acting more like how they did when they were 6 or 7, that could be a sign that they're having some difficulties coping. If they're getting irritated in ways that are unusual for them, if they are younger and maybe they're potty trained and they start either wetting the bed or having accidents, that can be a sign that they're struggling with the emotional impact of what happened to them. And as an adult, it's important to create a safe and comforting environment around them to make sure that they can ask you questions, that there's nothing off limits, that you're reassuring them that you love them and you care about them, and that they feel emotional safety to open up to you as an adult so that you can sort of help guide them in their recovery. And if they're really struggling and it lasts, more than some days or a week or two, I would really encourage folks to work with your primary care provider to seek some type of mental health counseling. It's another challenge in the summertime is that kids are out of school. So I think they don't have the same professional support systems around them. So that's why it really does fall on their immediate families to pay attention to these things.
Okay, got it. Thank you so much for that. Now, can you, Dr. Polakidis, can you tell me?
I had one other quick thing I wanted to add,
Andy.
Which is also for children, it's not just if the incident happened to them, but if they witness it. So I think that's also important that if there is a serious injury to an adult and there are children around, it's important to pay attention to that. So if an adult has a serious injury to, say, their hand from an exploding firework and their children that see that witnessing something traumatic can be just as serious as it happening directly to you. Sorry.
Thank you so much. That is a very good point. We forget when people see things, it still impacts them. All right. So Dr. Polakidis, can you tell us when should we go to the emergency room or even call the doctor?
Absolutely. I mean, if you even question it, I would actually just come to the emergency room right away. The American Burn Association gives referral criteria for some hospitals or even referrals of patients to go direct to the emergency room. Usually it's around burns that are much larger than 10% of second degree. Any size third degree burn could come to the emergency room. But realistically, if pain's not controlled, you're uncomfortable, your wound is large, realistically, that should be in an emergency room setting and it's not into a burn center. And so, we really want to actually see our patients right away, because we can actually try to hopefully instill some kind of intervention that will prevent them from requiring a significant amount of burn grafting or burn care. And so hands, face, feet, genitalia, that's another area that if you get burned, those are things that you want to come in. We like to tell everybody to bring all the pediatric burns in for the pure fact that we can sort out whether there's use potential there or a neglect potential there. Some of the elders, because of elder abuse and their inability to kind of accommodate themselves and be able to care for themselves, are some of the just generalized burn referral criteria to just say, come on into the hospital and let us care for you. You got to remember, as we're younger and older, our skin's a lot thinner. And because of that thinner skin, it takes a very short amount of time to actually burn yourself. When you just look at scald burns, for example, and you look at tub submersions, when a child is in a tub for 5 minutes at 110 degrees, it takes that 5 minutes to cause a third degree burn. At 150 degrees, it only takes 3 seconds for that child to get a third degree burn. And that very similar thing happens in the elderly population. And so they're a more sensitive population, both elders and children at extremes of age. And so we want to see them obviously much quicker.
Okay. So you kind of touched on this in that answer, but can you kind of categorize what different kind of burns we see? I heard you say first degree, third degree, scalding. Can you give us the different categories of burns?
Sure. We're going to go over first the degrees of burn, and then also the types of ways you can actually burn yourself. So first degree is, in essence, like a sunburn. It just involves the outer layer of the skin called the epidermis. Usually just a little bit of lotion, massage, some soothing type gels, and that'll actually kind of sustain, get the patient comfortable. As Catherine mentioned, Tylenol, Motrin, and above that, you're going to probably start looking. And there are some severe first degree burns that get sunburned. Second degree burn goes into the deeper portion of the skin called the dermis, and those are usually your blistering type burns. We don't want you to rupture the blisters again, because that becomes a risk for infection, but it also significantly increases your pain risk as well. Third degree burns now kill off the skin. And when the third degree burn occurs, actually those are the patients that are going to require a skin graft. And that's why we say everybody should actually come in effective. And again, let us make that evaluation, because sometimes it's hard to tell as a lay person what a third degree burn is. And there is something called a fourth degree burn, where muscle and bone are completely irreparably damaged. That ends up in amputation a lot of times. Thankfully, we very, very rarely see that, but you can still see that. That being said, injury mechanisms that you can see, we kind of alluded to some of them with, fire, and then scald. Then there's electrical and chemical burns that also, unfortunately, rear their ugly head into our world and can cause significant burns as well. And you can see these chemical burns, with explosions and with different chemical plants and in factories where people work in. Thankfully, they're lesser of our injuries because of OSHA and safety mechanisms. Those are kind of all of our injury mechanisms that we see.
Okay, thank you. Catherine, did you have anything you wanted to add to that?
No, I think he covered a lot. There's other ways too of getting burns with like electrical burns if you get shocked by hitting live wires and stuff like that. So at any time, if you ever feel like you're getting a shock, you should get checked out as well.
Okay, thank you so much. Now let's go back to kind of children a little bit. How can parents talk to their children about burn safety so they understand, so they're receptive to the information? And I'm just going to do two as together so I hope you follow. What should parents, family, and friends be aware of? And what are some of the alternatives or precautions to ensure you can have a summer that is safe, that is still fun, and includes these things in a safe manner? So how can parents talk to children about burn safety, and what are some precautions that we can take?
That's a great question, Mercedes. If you think about your daily household activities, from putting ramen noodles in the microwave and pulling those out, from cooking even just macaroni on the stove and boiling the hot water, just simple common sense type maneuvers just for mitigation and prevention of injury. Keeping the children out of the kitchen, especially away from the stovetop areas, will prevent them from grabbing, different types of things on the stovetop. But again, we recommend putting pots and pans on the back burners so that the kids can't reach up and pull those down. Same thing with the microwave and the ramen noodles. Unfortunately, they put the ramen noodles in a styrofoam cup, and the minute the children grab those styrofoam cups become very flimsy, and then they a lot of times spill them into their laps, causing burns to their private areas as well as their thighs. That can be extremely painful and exquisitely tender for the children. And so, just common sense things. Let mommy and daddy do this. We're going to get you set up at the table, and we're going to eat at the table in a very safe fashion, ensuring that the liquids that are in the microwave or on the stovetop are cooled at that point in time. Same thing about getting into the tub, making sure that the water is tested repeatedly with the back of the hand by the parent, not the child, to ensure that that water temperature doesn't change, because sometimes you may have fluctuations in your same temperature water, even though you may not have changed the dial, and you want to make sure that the babies don't sustain a burn in the tub or shower. And then as you go outdoors, keeping the kids a safe distance away. I would say at least 100 yards away from any kind of fireworks being implemented. Keep them away from the fire pits, so that they really have fire safety, so that they don't fall into the fire pits, because that's also a common methodology they get burned. And then also away from the grills, because again, if the grill gets out of control or tips over or what have you, we want to have the little ones away from that as much as possible to ensure their safety. So again, that they enjoy their summer and not spend time with us, unfortunately.
Yeah, understood. Catherine or Andy, did you have anything additional you wanted to add?
No, I think Dr. B covered a lot of it. It's
Okay.
definitely just keeping an eye on your kids and just making sure that there's supervision around any source of heat or fire.
Yes, definitely agreed.
Yeah, I agree. And I think also being mindful of, a lot of times, a lot of adults, we like to enjoy ourselves and have parties and things. And a lot of times it's important to recognize if people are intoxicated and things like that, that maybe somebody isn't being as mindful of the children around. So making sure that if people are, drinking and things like that, that there's still adequate supervision of children.
Yeah, I think that's a very, very good point. We have designated drivers for driving safety. We need almost a DD when we're partying, especially with children around. You want somebody that is kind of rational, level-headed, watching to pay attention and to avoid these precautions. So this is my last question. Can we touch on sunburns? People may not realize how quickly that a sunburn can get serious. When does too much sun become an emergency?
Well, we would recommend that you don't ever get to that point. And so what we always recommend for everybody, burn patients that are going back into the community and everybody as a whole, just based on, just national criteria for skin cancers and the such, is using a good SPF 50 sunblock. We realize people want to get nice tans and the such. The sun can actually start to burn you within the first 10 minutes, especially at a hot point during the day, anywhere from 11 to 3 o'clock. And so those are very difficult times. So whether you have mitigation where you just get out of the sun during those hours or seek some shade, but definitely want to apply the sunblock on extra well during those times. The misnomer about sunblock is that it's sport, it's waterproof, it's, some of these shirts have SPF. And if you can wash dirt out of a shirt, you're going to wash the SPF out of a shirt. So we still recommend the sunblock, whether it be lotion or the spray. But more importantly, even though it says sport or waterproof or the such, we just also recommend reapplying, because again, we want to minimize what we have in terms of injury from the sun because of how powerful the sun is.
All right, thank you. Anything additional from either of our panelists, Andy, Catherine? Okay.
Just one last thing, Mercedes, I'm sorry. And again, another misnomer about sunburn is that just because somebody is dark skinned or African American or a person of color, that they can't burn, and they can actually burn. So we want to make sure they are understanding. And then my last point is that, even though we're here just as a foursome, the burn care that is provided is a mountain of work that happens with an enormous team, not just one person in that team that actually is instrumental. It's the whole team that comes together. From, again, and I'm going to say my part's the least, from the nurses who are doing the bedside care every day, the therapists who are actually getting the patients out of bed and walking them and working their hands from occupational and physical therapy, the nutritionist who actually facilitates ensuring that their nutrition is optimal because the big burns can actually really cannibalize a patient, the social workers such as Andy and his team, including themselves with the psychiatrist to really get the mental health aspect of the patients well. And it's really just a huge team effort. Catherine and all the nurses, yourself, everybody has to come together just to get one burn patient out the hospital. And we actually have hundreds and hundreds that we see every month. And so I can't be more proud of our team, and I can't be more proud of being part of that team. And as I said, my part's so minimal in terms of the surgery and some of the critical care that goes along with it. But it's a huge monumental effort to try to get these patients better. But when they are better, they succeed and they thrive in a fantastic manner and get back into society and never miss a step. And so we're very proud to work for Cook County Health and be able to provide care. Just one last thing is our clinics. The clinics are open 5 days a week, Monday through Friday, from 8 o'clock until 1, but we will see anybody any time of the day. Our trauma ER is the same site where our clinic is, and they actually provide fantastic care from both a trauma and burn perspective, and we really give you a comprehensive evaluation when they do come in as an admission type burn. And more importantly, our staff is second to none. Really does the out of their way care to provide, love, compassion, dignity, and respect to our patients in a godly and safe manner. And so we really want to highlight those important facts that happens here at Cook County Health.
Yes, thank you so much for that. Well, I would like to thank each and every one of you, Andy, Catherine, Dr. Polikides, for joining us as our guest and providing this information. It is truly invaluable. I would like to thank everyone who's joined the live stream or who's going to watch this later and be informed more about burn safety and burn care. At Cook County Health, we are extremely proud of the work that our trauma and burn team does. As you just heard, Dr. Polikides, it is truly a team effort to make sure when our patients come in the door, they are getting the best care possible. We are ready to care for your needs as they arise. If you are concerned about a burn injury that you have sustained, please do not hesitate to call us at 312-864-1000. Again, that is 312-864-1000. You can make an appointment there, or you can come into our trauma front room and get seen that way. But if you call first, you may get the best service. All right. If we don't have anything else, we are going to wrap up. Thank you. I appreciate you all. Have a good day.
Thank you for
Thank
saying.
you.